Information for health professionals about the Screening Questionnaire for inactivated injectable influenza vaccination. Are you interested in knowing why we included a certain question on the Screening Questionnaire? If so, read the information below. If you want to find out even more, consult the sources listed at the bottom of this page. One, is the person to be vaccinated sick today? There is no evidence that acute illness reduces vaccine efficacy or increases vaccine adverse events. Persons with an acute febrile illness usually should not be vaccinated until their symptoms have improved. Minor illnesses, with or without fever, do not contraindicate use of influenza vaccine. Do not withhold vaccination if a person has taken antibiotics. Two, does the person to be vaccinated have an allergy to eggs or to a component of the vaccine? Allergic reactions to any vaccine component can occur. The majority of reactions probably are caused by residual egg protein. Although current influenza vaccines contain only a limited quantity of egg protein, this protein can induce immediate allergic reactions among persons who have severe egg allergy. If a person can eat eggs, they can receive inactivated influenza vaccine. However, persons who have experienced an anaphylactic reaction, such as hives, swelling of the lips or tongue, acute respiratory distress, or collapse, after eating eggs, should consult a physician for appropriate evaluation to help determine if vaccine should be administered. Persons who have documented immunoglobulin E mediated hypersensitivity to eggs, including those who have had occupational asthma or other allergic responses to egg protein, might also be at increased risk for allergic reactions to influenza vaccine. Consultation with the physician should be considered. Protocols have been published for safely administering influenza vaccine to persons with egg allergies. Fluzone, or sanofi pasteur, contains gelatin as a stabilizer. Therefore, a history of anaphylactic reaction to gelatin is a contraindication. Some inactivated influenza vaccines contain thimerosal as a preservative. Most persons who had sensitivity to thimerosal when it was used in contact lens solution do not have reactions to thimerosal when it is used in vaccines. Check the package insert at www.immunize.org/package inserts for a list of vaccine components, which explain excipients and culture media used in the production of the vaccine, or go to the website listed on the screen. 3. Has the person to be vaccinated ever had a serious reaction to influenza vaccine in the past? Patients reporting a serious reaction to a previous dose of inactivated influenza vaccine should be asked to describe their symptoms. Immediate, presumably allergic reactions are usually a contraindication to further vaccination against influenza. Fever, malaise, myalgia, and other systemic symptoms most often affect persons who are first-time vaccinees. These mild to moderate local reactions are not a contraindication to future vaccination. Also, red eyes or mild upper facial swelling following vaccination with inactivated injectable influenza vaccine is most likely a coincidental event and not related to the vaccine. These persons can receive injectable vaccine without further evaluation. 4. Has the person to be vaccinated ever had Guillain-Barré syndrome? It is prudent to avoid vaccinating persons who are not at high risk for severe influenza complications, but who are known to have developed Guillain-Barré syndrome within 6 weeks after receiving a previous influenza vaccination. As an alternative, physicians might consider using influenza antiviral chemoprophylaxis for these persons. Although data are limited, the established benefits of influenza vaccination for the majority of persons who have a history of GBS and who are at high risk for severe complications from influenza justify yearly vaccination.